Okay. Hello, Jane. I am from CLCI, Catherine Weil-Olivier, and we are extremely interested in life course immunization. I know from your side that you have worked extensively on aging, healthy aging, but also chronic diseases. So today it is the third postcard of a series about vaccination and how to improve or implement vaccination strategies, focusing on healthy people. So, Jane, would you present yourself?
Thank you, Catherine. It's a great pleasure to be with you today and to talk about this very important area.
So, healthy aging is a reality of life. It's appearing, as I am a pediatrician, I say as soon as you finish growing, you start aging. And it's a reality. But you feel the aging by the age of 50 or 60, even if you don't have any comorbidities. So, healthy aging is something extremely important because we belong to the society and we need to still be active in the society. And so, how do you explain, for example, immunosenescence, which is
Mm.
a part of aging?
Look, it's a very good question, and immunosenescence is very different to protection, and I think we need to differentiate. So, immunosenescence, very simply, is the natural aging of the immune system, and this means that our biological response to infection or vaccination can be slower or weaker. But that's different to protection. And sometimes, there's a bit of confusion. Protection is what we actually see in the real world, how well vaccines prevent serious illness, hospitalization, or death. And another way that we can think about this is if you think about wearing a seatbelt, it might not stop the crash, but it dramatically reduces the harm. And if we think about our immune response, it may look lower in older adults, but the vaccines still protect by softening the blow of the infection. And that's why it's vitally important that in the latter half of life, and as you quite rightly said, we really are aging from birth, aren't we?
Yeah.
In the latter half of life, we really need to think differently about our targeted interventions in health promotion and prevention for older adults.
Now, obviously, to protect oneself is a fact of life. Life is a risk per se, and
Mm,
infectious
mm,
disease are part of the risk. So, if
mm,
you can prevent infectious disease, it will be obviously better for you and your surroundings.
mm,
Once
mm,
again, as a pediatrician, I support strongly the idea that vaccine policies, vaccination should be intergenerational. And
mm,
so everyone is accustomed to protect a child. Young people traveling understand that maybe they are protected against certain diseases. And why
mm,
not go forward and try to add that parents and grandparents should get their vaccines, usually on a casual way, in order to protect. So, how do you see vaccines in healthy aging?
mm. Well, I think we can look at the profession of geriatricians. Now, geriatricians are specialists in diagnosing and managing um, the chronic comorbidities of older people. And as we know, as we grow older, there's every likelihood of complications in the diagnosis and function. So an older person, is really likely to have one, if not more, chronic comorbid conditions such as cardiovascular disease, diabetes, etc. But I do see a change in the way that geriatricians are operating too. This is not about treating diseases. This is about ensuring, health promotion and prevention, maintaining and improving the functional ability of an older person. And when I think about older people, I really think about the latter half of life because we often see three different trajectories. A trajectory which is a gradual change in functional ability. And we all want that because we want to add life to years, not years to life. And then we can see, a sharper, decline in functional ability. And that could be because a person's been hospitalized with influenza and returning home, if they do, they will never return to baseline function. But then the other trajectory that none of us ever want to be on, which is rapid decline, and that could be someone that's had a number of comorbidities, hasn't been vaccinated, and then they fall and fracture their neck of femur. So you're quite right that it's important. I don't talk about life course approach anymore. I believe that there needs to be a life course implementation of vaccine schedule that's comprehensive in the latter half of life, equally as it is comprehensive in the earlier part of life. So I'm a great advocate for life course, but certainly I believe that we need to pay a lot more attention now to the latter half of life.
Well, I think there is a better sensitivity with this aspect since the COVID. And I see that in my country, where we have implemented immunization strategies for older adults, and they are quite well taken so far. They are quite simplified, and they know which vaccines when. And this is a real progress. It's a positive impact of the COVID.
Look,
But,
I would certainly hope that we follow your example, Catherine, because France is certainly a standout example, not only in the schedule, but in those that are the vaccinators, with the pharmacists. And
yeah.
that's an important point because one of the barriers for older people to be vaccinated is, easing mobility to the vaccinator. So to be able to go to the pharmacist and be vaccinated, is a game changer for many older people. But we still need a lot of work in other, EU countries and around the world. But thank you for your leadership.
I would add that to simplify, we have by internet the capacity to put all the vaccines we received. And so it's available for the doctor, it's available for the pharmacist, it's available for the patient, and they know exactly. But you're right, the simplicity of the logistic of a vaccination is something absolutely essential. And I do appreciate what you say about implementation and not only defining a strategy. The strategy has to be applied, and to be applied, you require implementation, definitely.
Yes,
But
yes.
what you are evoking leads to a third point, which is the societal and economic impact. So definitely, we want to protect the whole family. It's good for everyone if older adults are getting better a longer time. But on the societal and economic point of view, something is probably a bit missed in our societies. Could you explain more?
Look, certainly. Aging populations are painted very vividly as a burden to society and a burden to our healthcare systems. But in reality, you know, this massive demographic upheaval is actually driving and shaping our economies. There are very good examples across Europe where older adults are workers, they're volunteers, they're mentors, they're caregivers, they're consumers. And so they really are driving the economy in many respects. The challenge, though, Catherine, is that we as individuals and society, but also governments need to invest in health promotion and prevention for the latter half of life. And we know that that's not the case in most countries.
No.
The OHG report is very clear. For every $1 invested in vaccination, there is a 19 times societal return. That's tremendous return on investment. But we're constantly challenged about, not the effectiveness of vaccines, but where do governments actually put the dollar. And we've got to remember that healthy older people continue to work, continue to volunteer, and this is the invisible, benefit to society. So it's a very large argument and conversation to have.
I couldn't more agree with all what you say. And we have to work hard to bring those ideas to the public. And we have really to work on it because it's so important.
Yes.
And so then it leads us to the next point, which is about policy and innovation. And could you give us your ideas about those aspects?
Look, very simply, we need to implement the policy of life course. We need to stop treating vaccination as something that ends after childhood. I think we're doing a better job these
Yeah.
days, particularly as you've said, post COVID. But it feels to me, Catherine, that we've taken 2 steps forward, but 1 step back because the urgency of a pandemic has actually shifted.
Yeah.
So policies really do have to identify and prioritize. Now, when we talk about older people, we're talking about age based criteria. But then, of course, we need to also think about the risk based criteria. And many countries kind of split this criteria. Age based starts at 60 or 65, but then you've got this other, risk category. And so I think we've got to, and of course, you and I would agree about the harmonization, of some vaccinations. How can we, when someone's coming to be vaccinated, is it COVID and flu? Is it flu and pneumococcal? Is it? So we've actually got to look at the system that's going to maximize the opportunity for a person to be really covered. I think you've already mentioned this, but I do want to just mention when we talk policy, it's not only what vaccines and reimbursement, it's streamlining the process. We know reminders are very important. We know that intergenerational programs are actually very important. A grandparent, needs to be vaccinated to be able to then care for their grandchildren. So you've got that storyline. And so policies are not just we've got the vaccine, it's reimbursable, and it's there for you to have. We've got to simplify the process and put policies in place so that people can actually easily access and feel comfortable with the information that they're being received.
I would like to rebound about two aspects. First, harmonization. Harmonization of our schedule is not possible, will not be, at least in Europe. But harmonization of ideas, yes, definitely.
Yes,
So
yes.
we have to change our minds from a childhood program or only risk groups to this large perspective. And this is something we have still to work on.
Yes,
Second aspect is that the perspective of politics or economists is not at all the perspective of an individual receiving the vaccine. And so the way you explain, the way you communicate, the way you try to convince and to reassure and to listen to any queries or questions for the patient is so important. And so we have to work on different levels. And clearly, you have the level of the public, individuals or families. I think focusing on households may be quite important because we can create a dynamic. But also, you have different strata. You have the authorities of health, and then you have the politics, and then you have the finance aspect. And so it's a complex situation. And then you have real science at the early beginning in order to demonstrate something.
Yes, look, I don't disagree with any of your comments. I do think though that we seem to have got it pretty right in terms of pediatric vaccination.
Yeah.
Um, and we've got some ways to translate the ideas
Yeah.
but I do think we need a lot more attention
Yeah, absolutely.
on understanding. And of course, co-administration, could play an important part. Yes, it's complicated, but that's no reason to be brave and,
Yeah, absolutely.
innovate.
Absolutely. So, what would be your final wish for
Mm. Look,
vaccination and healthy aging?
look, the story of longer lives is not just about adding years to life. It's about life adding life to years. And vaccines and vaccination, we all know, they are one of the most effective public health interventions. They not only protect individuals, families, societies. These are common phrases, but it really is up to each and every one of us, to step forward and understand how to best target, people in the latter half of life, and to outreach and put in place simplified systems, that they're going to be able to fit in to their very complex daily life. So we do have a way to go, Catherine, but I think experts such as yourself, paediatrician, talking about life course is a great way to move forward.
I would like to go on your way, definitely, reminding that from 65, most people in Europe are able to live up to 20 years. But
Mm,
among those 20 years, only half of them are in good life.
mm,
And why not transform this half part in a total part,
mm,
trying to
absolutely.
escape infectious
Absolutely.
disease? And we all know that infectious disease are giving what you said very precisely. There are long recovery, dependency, cost for the society, and definitely we have to work on that part more. And this is something very attractive. It's something not really known by the public. The fact
Mm,
that you live 10 or 12 years in a good life and then you are decreasing for several reasons,
mm.
depending on the people. So we have, once again, I think, and thank you for all your ideas. I am totally online with what you say, and you express it very simply and very well. Thank you. But really, we have to explain that to the public more.
Mm.
And so I may think that it is one of the idea of this podcast, and I hope that you will be listened at very carefully. Thank you, Jane.
Thank you very much, Catherine. It's a pleasure to be with you
Yeah, it
today.
was, really.